So good afternoon and welcome to today's special joint seminar hosted by the University of Toronto Joint Centre for Bioethics and the Collaborative Centre for Climate, Health and Sustainable Care. My name is Ross Upshur, and I'm a professor in the Dalla Lana School of Public Health and the Department of Family and Community Medicine, and also the co-director of the WHO Collaborating Centre for Bioethics and the co-director of the Collaborative Centre for Climate, Health and Sustainable Care. So on behalf of the Joint Center for Bioethics and of the Collaborative Center for Climate, Health and Sustainable Care, I'm delighted to welcome Professor Stephen Gardiner from the University of Washington to explore the topic of the early ethics of planetary health. And we're fortunate also to have a guest commentary by Dr. Jeff D'Souza, and I'll introduce them very shortly. But first, I'd like to commence with a land acknowledgement and to acknowledge that the land on which the University of Toronto operates for thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and most recently the Mississaugas of the Credit River. Today, this meeting place is still the home to many Indigenous peoples from across Turtle Island, and we're grateful to have the opportunity to work on this land, and not just to work, but to live, and in my case, to raise a family. And I think that the themes and concepts that we'll be discussing today are highly relevant to our appreciation of the land and to the contributions that Indigenous scholars have made to our thinking about planetary health. So first, I'll start with some housekeeping. The format for today's seminar, is as follows. Professor Gardiner will present for about 45 minutes and then be followed by about a 5 to 10 minute commentary by Dr. D'Souza, and then we'll open up the discussion with you, the audience. Ample time has been set aside for question and answers with the speakers, and during the discussion period, we invite you to pose a question using the YouTube chat function or to send your questions via email to jcb.ea@utoronto.ca, and that will be put into the YouTube chat. Questions will be grouped by theme and summarized to ensure as many questions may be addressed during our time together. And please note that today's seminar is being recorded. You will be able to access it along with other archived JCB seminars on the JCB's YouTube channel. Now it's my really great pleasure to introduce today's speaker and our guest commentator. So Professor Gardiner is a professor of philosophy and the Ben Rabinowitz Professor of the Human Dimensions of the Environment at the University of Washington, Seattle, where he is also the director of the program on ethics. His work in ethical theory and political philosophy focuses on climate ethics, global environmental problems, intergenerational ethics, and virtue ethics. He is the author of A Perfect Moral Storm, The Ethical Tragedy of Climate Change, which I encourage everybody who has not read it to read, and co-author of Debating Climate Ethics. His edited books include the Oxford Handbook of Intergenerational Ethics, The Ethics of Geoengineering, the Global Climate, the Oxford Handbook of Environmental Ethics and Climate Ethics Essential Readings, as well as Virtue Ethics, Old and New. His latest book, Dialogues on Climate Justice, co-authored with Arthur Obst, tells the story of Hope, a fictional protagonist whose life is shaped by a series of conversations about ethics and justice in a climate-challenged world. And you can tell from this that he is the ideal speaker to kick off the first of what we hope are many collaborative seminars on the theme of ethics, climate change, and planetary health. We're also fortunate to be joined by Jeffrey D'Souza. And Jeff is a member of the Joint Centre for Bioethics at the University of Toronto and a research scientist at McMaster University's Centre for Climate Change. And prior to becoming the manager of the Human Research Ethics at the University of Toronto, he was an assistant professor in the Dalla Lana School of Public Health. His formal academic training is in virtue ethics, and his early scholarly work focused on the role of moral virtue in living well. His recent work focuses on research ethics, climate change, and global health, and he's the lead of an author on a paper entitled Clinical Research Ethics, Climate Change, and Global Health in the Journal of the American Medical Association in 2023. He also has a book chapter coming out in the Handbook of Environmental Bioethics this year, entitled Have We Been Miscalculating the Potential Benefits and Risks of Research All Along? A closer look at the interconnectedness of research ethics, climate change, and global health. Stephen, welcome to Toronto. We are thrilled to have you here with us today in the spirit of cross-border collaboration, and I will turn it over to you. Thanks so much.
Thank you, and thank you so much for inviting me, and thanks for everyone for being here, and especially to Jeff for troubling himself with my work. So anyway, so let's jump into this paper, which is called The Early Ethics of Planetary Health, and it's a joint work with Professor Paul Tubig at Georgia Southern University. So we're interested here in the idea of broad conceptions of bioethics, right? In some circles, bioethics can become very restricted to refer to a narrow set of concerns in, say, clinical ethics, healthcare provision, and health technologies. But historically, it has been associated with a much broader meaning at times, and including at its very origins. So Fran Rensselaer Potter once said that bioethics should be understood much more broadly than healthcare as the name of a discipline combining science and philosophy with wisdom, and in particular, knowledge of how to use knowledge about human survival and flourishing as its goal. Now, over the last 10 to 15 years or so, a new concept has been launched on the scene, the concept of planetary health with bold claims such as it is time for a new discipline. And this concept of planetary health fits into a broader agenda of trying to what I call environmentalize public health and bioethics. Partly the reason for this is practical. It's to fit the emerging times where increasingly the determinants of health are not just social but ecological, and where transdisciplinary approaches are needed to get to grips with that fact. It's also often said to fulfill a deeper conceptual need. So planetary health is sometimes touted as the natural successor to public and global health, and so is a necessary corrective in a changing health landscape. We should be a little bit careful about the notion that it's a new concept, or at least as new as the last 10 or 15 years. For example, notions of planetary health seem explicit and implicit in many indigenous frameworks for dealing with the environment. Explicitly, it was used in more Western frameworks. The term was used in the 70s and 80s. And the core idea of interconnectedness between humans and the rest of the planet, including in relation to human health, has been a central theme of environmental ethics in the Western Anglo-American camp since at least the 60s and 70s. So the broad idea is not so new. One might also say that within health and medicine circles, planetary health is related to a whole set of other concepts that have emerged many prior to it, such as One Health and eco-health and conservation medicine. This problem of embeddedness in a broader, or this issue of embeddedness in a broader narrative, is important to some because they think that treating planetary health as if it's new or completely new obscures some important things about how the actual recent discussion has been emerging, including that prominent actors in pushing forward the concept are like the Rockefeller Lancet Commission and so on, involve powerful agents that play a certain role in the ecosystem of global public health. And it's worth highlighting those things to make sure, in particular, that insights from earlier discussions are not lost as time goes on. So you see here from this quote on the slide that Prescott and all worry that there might be issues of in-group dominance if we focus too much on the institutional conception of planetary health and don't realize that it's very recent. But I'm not here to talk about issues surrounding the politics of the concept of planetary health or how they arise. I'm going to talk about conceptual issues in a way that befits philosophers, I guess. So in this paper, we try to identify the normative work that is needed to refine planetary health as a concept. right? And we're going to focus on how the notion is deployed by its major proponents, and especially by the foundational Rockefeller-Lancet Commission report in 2015. We want to try to identify some key tensions that need to be addressed as planetary health evolves as a concept and as a discipline, and articulate an agenda for future research. Part of the reason for getting engaged in the project is, even if it were to turn out that planetary health somehow fades as a concept, many of the lessons that need to be learned here would be relevant to the wider family of existing concepts like One Health and EcoHealth, but also any potential successors to them and planetary health. So let me jump in now to the concept of planetary health itself. So in a bare way, the surface meaning that people often grasp when they hear the term planetary health is just it's a way of putting together planet and health, and it's health broadly seen as from a planetary perspective. And in particular, this slide I mentioned before, that human health and the health of the environment are inextricably linked. That idea seems very attractive, indeed totally uncontroversial to many people. One of the reasons for the attraction is probably that the notion of health is already implicitly normative and has positive connotations. So just the phrase planetary health automatically encourages a kind of enthusiasm for the idea and discourages dissent from it. It's almost as if, if you were to be opposed to planetary health, you'd be accused of being in favor of planetary sickness or planetary disease, and probably nobody wants that. Nevertheless, the simple association of the two terms is not enough to ground planetary health as an effective concept. Indeed, there's a background threat of vacuousness that if we only get that far, then we won't be able to make the right kind of progress. A few years ago, one set of authors observed that in their experience, discussions of planetary health had already raised this kind of threat. Right? They've been becoming peppered with a series of phrases, I'm quoting here, that seek to capture the zeitgeist of the approach, but do not always contain much substance. And from this, the authors say there's a danger that the planetary health concept will have little impact if this isn't resolved. So what we're going to try to do here is move beyond planetary health as a buzzword and try to ground it in such a way that makes it sustainable as an organizing concept in the longer term. Or rather, we're going to raise some of the essential questions that need to be addressed and assess where the literature was in its early stages. Some sample questions we need to ask when trying to move beyond the buzzword stage is to ask what standard or levels of attainment are denoted by planetary health or by the planet being healthy. We need to ask what kinds of states or phenomena does planetary health track, and what kinds of norms should govern its pursuit. Now, we can begin with a broad, generic definition of planetary health that essentially I think everyone agrees with. That's planetary health as broadening health research to include the external systems that sustain or threaten human health. But already we can see that this generic definition contains various ideas that need to be explained a little further, such as broadens health research, external systems, and human health. And it turns out that there are numerous ways to do this. So our approach is to observe that actually early proponents of planetary health as a concept differ in their interpretation of some of these key ideas. And to illustrate that, we're going to use a heuristic. We're going to contrast what we call narrow visions or interpretations of planetary health with broad visions or interpretations of planetary health. Now, this is a heuristic. It's just for the purpose of illustrating some issues. Our actual view is there are not two sharply defined camps here, but rather a spectrum of views from the very narrow to the very broad. And most people are probably not at either extreme, but at various points on that continuum. But still, the heuristic is useful for getting going. So what's the narrow vision of planetary health? Well, typically what we see in narrow visions is that they're narrow in approach. Like planetary health is seen as largely an empirical project driven by needs in the natural and social sciences. And the task is to address a knowledge gap, right? Things we don't know that would be very helpful to know from the point of view of health. And the planetary health agenda is supposed to address that need. So the central concern on the narrow vision is with expanding research to account for widespread effects of natural and social systems. The narrow visions are also narrow in their target or scope of concern. The target is human health, narrowly and traditionally conceived, kind of commonsensically conceived. For example, as roughly the proper or species typical functioning of the human body. And implicitly in the target, when taking this to be the target, is the idea that though there's much empirical scientific work to be done, the central values we're going to be pursuing here are already clear and given. They're given by the notion of human health traditionally understood. So we see some evidence of this kind of approach in various documents. When people say things like planetary health is a field focused on characterizing human health impacts, right? When the role of planetary health is seen as forging collaboration across an array of scientific disciplines with the aim of building a rigorous evidence base for informing policy, and where the remit of planetary health is supposed to be centered around training the next generation of scientists, communicating planetary health science, and applying planetary health science. So it's a very science, empirical-based understanding on the narrow vision. And the vision is also narrow in being focused on human health only, and again, as pretty traditionally understood. So we see planetary health described as a field characterizing human health impacts. A major book on planetary health by some of its leading proponents is called Planetary Health, Protecting Nature to Protect Ourselves, which is one reviewer in The Lancet put it, is certainly an anthropocentric title, one that treats humans as the only thing that matters in this context. And the UN, the United Nations, when it picks up on the notion of planetary health, also emphasizes the human health, only talks about protecting our own health, not health more broadly conceived. So that's kind of the narrow vision, what the narrow visions look like. We turn to broader or wide vision of planetary health. Here, people are accepting the basic claims of the narrow vision, namely that the orthodox approaches to public health are failing on conventional or traditional grounds, and that more science is needed. But if you're if you have a broader or wide vision of planetary health, you're focused on the idea that the reform needs to go beyond these basic claims of the narrow vision. Instead, we need a comprehensive account of the objectives and organization of the broad social order, globally, intergenerationally, and perhaps ecologically, especially across species. So we're going to be pushing beyond a narrowly scientific agenda when we're trying to promote planetary health to one that's explicitly normative and institutional, and perhaps potentially also political. So on these wide visions, the normative concerns of planetary health are not restricted to the promotion of human health, and especially human health narrowly and conventionally understood, but instead involve a broad range of moral and social values. So including human well-being more generally than just health, issues of inequality, intergenerational justice, and sometimes the welfare and interests of non-humans as well. So this suggests that a planetary health agenda would include interest in normative research on values and institutions, research that informs the process of social transformation that will be needed to promote an expanded set of values, and activities beyond research, such as institution building and sometimes various kinds of activism, including through professional associations and academic institutions to get planetary health needs addressed. So the upshot seems to be that the wide interpretation encourages a substantial reorientation of the central role and goals of public health. right? And with implications for institutions, some of which might be fairly dramatic. At the extreme, you might think, the planetary health agenda becomes primarily a call for a thoroughgoing rethinking of how global society should understand its central objectives. Secondarily, an appeal for the public health community to play a major and perhaps leading role in that transformation. And perhaps only thirdly, a call to change the ways in which public health professionals think about how to succeed in their traditional work of promoting human health, conventionally understood. Some evidence for this wider understanding of planetary health. One example is the early manifesto written in The Lancet by the founders of the planetary health movement called Planetary Health, quote, an attitude towards life and a philosophy for living. They claimed, quote, an urgent transformation is required in our values and our practices, end of quote. And they also called for, quote, a powerful social movement based on collective action at all levels of society, end of quote. And an account of the history of the recent idea of planetary health calls it a distinct formulation of environmental health where environmental ethics on a planetary scale productively meets human population health. Another example of the wide interpretation is the definition offered by the Rockefeller Lancet Commission itself back in 2015 in this founding document. They define planetary health as the achievement of the highest attainable standard of health, well-being, and equity worldwide through the judicious attention to human systems that shape the future of humanity, and the Earth's natural systems that define the safe environmental limits within which humanity can flourish. And they round that off by saying, put simply, planetary health is the health of human civilization and the state of the natural systems on which it depends. Oops. So despite prominent representations of the narrow vision, which I already mentioned, there seems to be ample evidence for the wide vision in the early history of planetary health. And indeed, I think the wide vision actually dominates the main conceptual claims of the movement. And perhaps that's not so surprising, given that some other well-known international definitions of health also seem to move in a wide direction, such as the World Health Organization's definition. But there are differences then in how these various claims, this is a slide we basically saw the basic ingredients of before, of how to flesh out the generic definition of planetary health in either a narrow or a broad definition. I summarize them in this little table. I'm not going to read that out, partly because it's obscured by the technology here, so I can't actually see most of it. But the general idea is that you can see how paradigm versions of the narrow and wide interpretation play out through different interpretations of the key terms in the generic definition of planetary health. What's the upshot of the presence of these two distinct understandings of planetary health? Well, I think people are a little bit divided on their attitude. Some people favor the narrow interpretation or something that's at least narrower, a flavor of planetary health. Why? Probably because it seems safer, right? The ethical basis in human health as conventionally understood seems pretty straightforward and at least less controversial. And it's an account of planetary health that everyone interested in planetary health could reasonably accept. But there are also anxieties about the narrow definition, in particular about whether it's too modest to do the kind of work that needs to be done in the face of mounting environmental concerns, such as climate change and ecosystem collapses and so on. On the other hand, many people are attracted to the wide vision because they think it's more enlightened in some general sense, intellectually and culturally. It encompasses a much wider range of values. It's sensitive to justice considerations at the social level and the environmental level. And it seems at least open to non-instrumental value for humans. But others are anxious about the wide interpretation. It can seem too radical. Is it so radical that it won't be able to ground a broad social consensus is a live concern. And does it seem to dilute the distinctive pull of the notion of health in ways that is counterproductive? So that's some general background to how we think about planetary health. I now want to say some more about the ethical foundations of planetary health. And I'm going to do it by looking at the Rockefeller Lancet Commission's definition of 2015, which I already read out, so I won't read it out again. But I will say we're going to be pointing towards three main elements of that definition, three things to notice. The first thing is that the definition selects and prioritizes three specific values. Like planetary health is about health, well-being, and equity worldwide. That's what the RLC says. I'm going to call these the triumvirate, right? The three rulers of the planetary health agenda as understood in this foundational document. Second, the RLC adopts a maximizing approach. The aim is the achievement of the highest attainable standard of the triumvirate, right? So there's a particular way of approaching those values, which is we need to maximize them. And then the third is the focus on the idea that it's the health of human communities that is really our focus. There is some need to pay attention to the state of natural systems, but that's for the sake of the health of human civilization. That's how it's initially and broadly understood. So what are some concerns about this, this kind of definition coming from the RLC? What are some critical questions we can raise as a way of motivating a further research agenda? Well, the first thing to notice is that there are only three values, right? So, so you might say, why are there only three? Right? There are lots of values out there that we're used to talking about in bioethics and in moral and political philosophy more generally. Right? And so you might ask, why these three? Given the list, there are some others that might come in, and that list could be enumerated in countless ways. So why pick the three? Well, the RLC doesn't give any definition, sorry, doesn't give any justification for picking those three and only those three. But one worry that might be lurking in the background is that sometimes in public-facing contexts, like public health, including planetary health, there can be a pressure to sort of really heavily simplify everything so that it's broadly accessible. So sometimes, I've been told if you want to reach a public audience or have influence in institutions and policy, the basic ethical values should be expressible in a really accessible way on the back of a napkin. And so you might say, well, there are three because three will fit on the back of a napkin, and these three people will immediately understand roughly what you're talking about. But of course, this seems like an unreasonable demand to make on the ethics of planetary health as a serious intellectual endeavor. We might need summaries that reduce to the back of a napkin for certain kinds of publicity purposes, but it would be odd to demand that that has to be, the sole extent of the discipline or even foundational to the work that we do. No one would ask a scientist in medicine or in climate or anything else to make sure that everything they say is reducible to three things that could be put on the back of a napkin and be readily understood by anybody who just walked in off the street. Further issues that arise about the triumvirate there are three of them. So how does one balance the three? What happens when there seem to be tensions between achieving all three? Are there contextual reasons for thinking that one or other should take precedence in certain kinds of circumstances, things like that? And then the fourth issue is what's going on actually in the background that we're supposed to have a really broad understanding of the three values? So, health, equity, and so on. So are we supposed to understand them in ways that solve the problem of only having three because they effectively absorb all the relevant others? So for example, maybe equity is supposed to absorb values like autonomy, rights, and justice. So we don't really need to add those or treat those independently. And perhaps well-being is supposed to include values around community and so forth. So there's a lot to unpack there about the three. There are also issues to unpack about this approach of maximizing the attainment of the three values, which is the approach that the RLC adopts, right? We're supposed to get the highest attainable standard of the three values. Maximization is always a tricky issue within moral and political philosophy because people fear kinds of approaches to ethics that are too ready to sacrifice to the greater good that is supposed to be maximized. So traditionally, utilitarian views, or at least very simplistic versions of utilitarian views, are accused of being too ready to sacrifice the individual to the well-being of groups. Right? So any fundamental doctrine that appeals to maximization raises worries like this. So in trying to maximize the triumvirate, what are we sacrificing to that heady goal of maximization? One issue that arises is there an assumption here that those three values never come into conflict? That seems an unusual and striking assumption. Is there an idea that somehow the triumvirate blend into one mega value that could make sure that there are no conflicts? Again, that's a bold thing to make. And one reason that this kind of dispute matters is that some explicitly have the ambition for planetary health, that it will be able to resolve important trade-offs, right? There'll be answer questions about trade-offs that have to occur in bioethical contexts, right? So some authors insist that that's a foundational notion or aspiration of planetary health. And this idea of the highest attainable standard does not seem to facilitate an answer to those questions. Another issue with the highest attainable standard is, does that mean that the three values are going to crowd out all other values? If you had a different kind of standard for achieving the three values, if you said things like we should have sufficient achievement of well-being and equity, then if you could achieve those values up to a sufficiency level, then other values could then play a role. But if you insist on maximizing the attainment of each of those values, then sacrifices of the non-core values seem especially likely to occur. And then lastly here, we might wonder more generally about whether there are some values included in the triumvirate or for planetary health in general, where we could say maximizing is simply not the right way to think about this. What we should be aiming at is a sufficiently healthy planet for humans and other species. We don't need to aim at a planet that is maximally beneficial or supportive for humans and other species, because we might have other important goals that we also want to respect. The third and final problem I want to identify in thinking about issues around the RLC definition, the Rockefeller Lancet Commission definition, is the worry that health is used to do too many things within the RLC's account. So on the one hand, it's embedded within the triumvirate, right? It's one of the three things, one of the three central values of health, well-being, and equity. But on the other hand, we still use the term planetary health to describe the overall concept, which includes those three embedded concepts. So planetary health is said to be the health of human civilization, right? This double usage of the word health raises some concerns. For one thing, it can undermine effective communication, right? Because anytime someone mentions, what are we going to do about health as a value within the planetary health framework, you have to ask, are we talking about health as one of the triumvirate, or are we talking about the overall conception of planetary health that includes health, well-being, and equity? That's awkward and potentially gives rise to lots of confusion. Second concern is the use of planetary health for the health of human civilization in general can appear much more rooted in public health than it really is, because it's a very expansive notion that, of course, includes well-being and equity now. And this gives rise to a third concern, which is really a bit of a suspicion, which is the Rockefeller-Lancet Commission's approach actually free riding on a different notion to make it seem appealing, right? Is the core expansive notion of planetary health, the one that includes the triumvirate, really a notion of something else, such as human flourishing? Because notice that actually the RLC and others use the term flourishing to describe planetary health on certain occasions, right? They talk about safe environmental limits within which humanity can flourish. But then we end up talking about health in the much more expansive sense as seeming to cover that notion. So for example, when they say that, put simply, planetary health is the health of human civilization, that looks an awful lot like it's supposed to be a notion of human flourishing. The other thing that comes up under this heading is there is a tension around how we're understanding whose health is at stake. As we said, under the narrow vision, often it's an explicitly anthropocentric notion of health, right? So an ethically anthropocentric notion in the sense that the claim is that it's only human health that we are concerned with. We're not concerned about the health of other entities such as animals, plants, ecosystems, and so on. But on broad interpretations, often we are including other forms of health, other entities, and including in some statements from major conferences involving the movement and so on. So that seems to be something that we need to resolve. Now, elsewhere, we make the suggestion that how we should start to deal with some of these issues is first, we should endorse a broader notion of planetary flourishing as the overarching ideal, rather than using the term planetary health. I think that will be the helpful way to disambiguate this double duty problem. And on that notion, we should understand, on that approach, we should understand planetary health as the nested concept, right? It's the member of the triumvirate that refers to health, right? So we're not trying to include well-being and equity within the planetary health notion. We'll include that within the planetary flourishing notion. That seems to be a better core approach. So having set out some concerns about how planetary health is understood, raises some background issues, and looked at the RLC's approach, at the end of this paper, we outline some elements of a research agenda. So the first element is to say that we think a satisfactory account of planetary health needs to specify clearly what the central values are of planetary health, and that will help us to better organize research and other activities. So under this heading, some key questions include, should the movement embrace a narrower or wider conception of planetary health? And if a wide conception is chosen, what values should it embrace and how should these be understood? And then third, should the planetary health movement be focused primarily on change within the public health community, or should it pursue a broader, for example, an activist agenda as part of its professional responsibility? And our suggestions have been here that we think the planetary health movement should continue more or less to embrace a fairly wide vision, right? We think that it should shift to characterizing its overarching normative concept in terms of a wider ideal, something like planetary flourishing or something similar to that, but retain planetary health as an essential but subsidiary component of the framework. Third, while we think the current triumvirate of the RLC focusing on health, well-being, and equity remains important, these values require further articulation and should be understood in ways that do not arbitrarily exclude other values. But then fourth, the movement should directly address central comparative ethical questions such as, should certain values be central while others are marginal, and how should the various values be balanced or integrated with respect to each other? And then finally, should planetary health be anthropocentric or non-anthropocentric? And we actually favor the non-anthropocentric approach. And recall that part of this is to try and help planetary health advance from being at the status of buzzword or a bit beyond buzzword to a more mature vision of the concept in order that it might be more useful and more sustainable in practice. There is one broader thing that we identify. We think that, and I pursue this a little bit elsewhere in another paper, we think that planetary health should seek to better understand the challenges it intends to confront, and also to consider how responsive its efforts are to those challenges. So I'm the sort of person who believes that understanding better what the problem is you're trying to confront is often a necessary first step on the pathway to good solutions. And so I think the planetary health movement would do well to think about that in the context of global environmental change. I think that it should center the idea of rethinking conventional concepts and what that really requires given the nature of the challenge, once we understand what the challenge is. And it should investigate how to reach out and align with the efforts of other agents, including academic disciplines, institutions, and organizations. I made a little bit of progress on this elsewhere in a paper on, oh, sorry, I went the wrong way there, I think I did. Yes, in a paper called Environmentalizing Bioethics, where I try to bring the concept of planetary health into conversation with my perfect moral storm analysis of global environmental change, especially as it relates to climate change. So I think there are interesting overlaps and synergies between the two things, between the planetary health concept and the perfect moral storm analysis, and that the planetary health movement does a pretty good job of recognizing some important elements of the perfect moral storm, but also could be enriched by thinking more seriously about others. So thank you very much for your time and attention.
Thank you so much, Steve, for that excellent parsing out of planetary health and its vision and its ethics. Well, pass it over now to Jeff. Jeff, please go ahead.
Sure. Thank you, Russ. Just wanted to piggyback what Ross said, and just thank you so much, Professor Gardiner, for such an incredibly thought-provoking talk, one which really invites us to reflect on the importance of the term planetary health in a way in which we might have not done before. And really, especially to hit home these ideas of providing sufficient conceptual clarity, analytical precision, this idea of environmentalizing bioethics as a field, and then also how planetary health might fulfill various other aims, and one of which obviously is taking action, investigation or otherwise, to address the current climate crisis. So to not take up too much time, I'm going to try to restrict my commentary to just 3 points. So my first point relates to this idea that you just alluded to in your talk, which has to do with the importance of planetary health, getting clear on the challenges and problems it intends to confront and address. And so here I was wondering, similar to how the World Health Organization puts out lists such as, the top 10 greatest threats in global health, whether it might be helpful for folks within the planetary health community to sort of do the same. So I'm wondering, if producing a list of, the greatest threats to planetary health might help us get a better sense of what planetary health is and what it's not, and how it might be better described and kind of captured. And so such a task as I'm conceiving it would be informed by problems faced by folks on the ground. But of course, it's just a suggestion, but I'd be curious to get your thoughts on the potential merits of such an approach. As a philosopher, some of the critiques that I get in some of my work is it's too high in the sky, start on the ground and then work up. And so this might be, something kind of that someone might respond to perhaps some of your work. My second point is related to this idea that you alluded to regarding planetary health as an organizing concept, needing to specify its central values in order to address trade-offs and better organize research and other types of activities. So here, I was wondering, within the domain of planetary health, whether it might be optimal to in fact not specify central values in order to allow for different folks from different backgrounds, worldviews, and normative ethical theories to participate in planetary health. So here I'm similarly to how we think of, so similar to how we might have, feminist ethical theories or approaches in global health, or utilitarian approaches in global health, or rights-based or African ethics approaches in global health. Perhaps the same should be true for planetary health, to sort of have a large enough tent so that other folks can kind of fit in with different persuasions. Because one of the challenges is trying to get folks to agree on, values and action-orienting guiding principles. So my third point is related to the opportunity cost associated with developing out a fully coherent and distinct conception of planetary health that does all what we might want it to do, conceptually speaking. So here I wonder whether we might want to take a satisficing approach so that we get to a place where we can distinguish, for example, planetary health from global health, environmental health, etc., and have a good grasp of what planetary health is or should be. And then we can shift our attention on action, such as trying to environmentalize other domains. So for me, I guess, it's important for those working in planetary health to build a strong domain, but kind of the cross-pollination across other domains of key concepts, such as the fact that the planet is valuable and worth preserving and respecting, independent of any good that the planet offers humans, is perhaps more important, right? So like, at what point can we shift? Okay, we got a good idea of the concept, and then now we got to sort of act. I think for lots of folks, who really experience this existential crisis, climate change, it's about acting, right? And it's about kind of, taking that next step, so to speak. So if I'm onto something here, and perhaps getting a sense of, well, when does that shift need to happen so that sort of cross-pollination can exist? I'll stop there, and thank you once again, Stephen, for your talk.
Thanks, Jeff.
Thank you.
Before we go to questions that are arising, Steve, would you like to reply to Jeff?
Yeah, thanks. They were thoughtful comments. I appreciate them, useful ones, and I will reflect on them more. Since I'm just hearing them, this will be, obviously just off the top of my head. I think one thing I would say to the last one about, the focus needs to be on action is that, in a sense, let's take a problem like climate change. We've been trying to act on that for at least 35 years. So I think action without concepts and principles and things to help guide it in complex situations is often just very hard to achieve. There are reasons why we need these frameworks, we need these principles and so on. So for people who are impatient to act, I would say I do think it's often worth some time to explore, how and why you're acting. And also because once you find yourself in concrete situations, you will find that some of these issues come up, right? Some of the conceptual problems will become very salient to you. So if you run out of the door determined to be a major planetary health actor, and you're director of an organization or a member of an organization, and you say, we want to do this in a planetary health way. Well, what do we need to do? We've got the 3 values. Oh, I don't totally know how to interpret those. And it looks as though there's a conflict between 2 of them in our context. How are we going to manage that? Well, that's the worry that planetary health might have done a good job motivating, getting you out of the door to start to act. But then if you find that it paralyzes you a bit, as soon as you start to confront anything serious, that's going to be a drawback of the framework. So I think the whole thing is supposed to be somewhat action-oriented. But the question of action always involves asking, well, okay, what are we actually going to do and why? And then you're pretty much back here, which I'm sure you appreciate. I like the question about specifying the central values. Inclusion is very important, and it's a strong emphasis at the moment in the way we discuss these things on procedural justice and justice and recognition that takes proper account of different voices and traditions and so on. And that is a very important part of any kind of ethical agenda at this level, I think. But you can also help that by including those things as part of the core values that you're going to be respecting within a planetary health agenda. And those things do play a key role in some recent proposals around trying to do justice around environmental issues, including policy documents. So I don't think the two things are antithetical, they're not deep conflict. And I also think that, it's worth asking people from diverse traditions as well as our own traditions, which are in themselves diverse, right? There's nothing monolithic about, say, my, particular narrow version of Western traditions, right? There's already a plurality there. But acknowledging that we who have those kinds of traditions often find philosophical analysis very helpful and insightful in making progress, and also often in identifying what problems we really have. And I think the same kind of approach might be true for lots of other people around the world, thinking about their traditions, trying to ask hard questions about what makes best sense of them and how to proceed by respecting them. So I do think those, and specifying central values is an important part of that. I think at what level of abstraction that's useful is an open question in ethics and public policy in general. And the top 10 proposal, right? The top 10 threats to planetary health. I kind of like that idea, but I put my own slant on it, right? I think what I would say is the community, the wider community of scientists and policy people, and including, some philosophers and so on, the community is pretty good at doing top 10 threat lists that are on the narrow vision of planetary health, right? That are very empirical, scientific, and impact-driven kinds of assessments. Pretty good at that, at least short-term ones. Whereas I would say we would want, I would say let's do something called the 10 threats to the concept of planetary health, right? And in a way, this paper that Paul and I wrote is part of a contribution to that, because we're a little bit worried that what starts as a good idea and one that we should be embracing can quickly turn into something that will, your bicycle, if the wheel falls off, one of the wheels falls off before you've turned the first corner, that's a pretty big problem for you. So we think the 10 conceptual threats would be worth highlighting. I'd be a bit worried about identifying 10 scientific impact threats and then moving on, as we always do. But thank you, they're very good comments, and that's only my off the top of my head reflections.
Thanks. So we're getting many questions coming in. So I'll turn to now our audience questions, unless Jeff, you want to have a rejoinder. Nope, I think he's content. So one is a question about what is the argument for continuing to pursue an even more mature conceptualization of planetary health versus adopting or returning to other earlier framings, such as One Health, or even, I've been quite surprised that deep ecology hasn't made a resurgence in the planetary health sphere. Any thoughts about that?
Yeah, I think that's a great research question on both sides. I mean, very different angles. The One Health, concept has a particular role in a particular area, and deep ecology has a very different role is in the context of a lot of other debates. One thing that we argue for in the paper, and it's something else we've written, is a positive step moving forward would be to actually engage with the literature in environmental ethics, environmental philosophy, more broadly, and global justice more broadly. Because many of these kinds of almost institution-led reports coming out of major organizations in healthcare, say, or associated with healthcare, or indeed any other area led by science and policy, often is trying to make some moves in the space of environmental ethics and global ethics and so on, with a sort of a kind of awareness that those subjects exist, but not much real engagement with them. I was recently reading a report, I won't name the report, but I was recently reading a report which had hundreds and hundreds of references in it to a whole host of papers, scientific papers. And there were only maybe 3 or 4 references to things that discussed underlying concepts in a kind of more philosophical way. And they were all to summary documents. Do you know what I mean? There's kind of overview things. They were serious summary documents. It wasn't Wikipedia, although I don't disrespect Wikipedia, but they were serious. But it was notable that that was the kind of the only way, that was the level at which those things got into the documents, even though the core concepts being discussed would, I think, have benefited from, you know, at least a paragraph or 2 for each of them that discuss them at a more philosophical, conceptual level. I think that part of the problem there is, I think we need more integration of bioethics into these communities, as is quite successful in other parts of the broad community concerned with ethics and health. It's quite successful in those areas, not so much in the environmental ones.
Yeah, no, I completely agree with you, having come out of the 80s environmental ethics before I went into medicine and public health. So the next question is, theories on flourishing or capabilities or well-being tend to situate health within these broader umbrellas. What do you think of how these 2 values have been used by RLC, the Rockefeller Lancet Commission?
Yeah. Well, again, I think these are rich notions, right? And there's a philosophical literature surrounding them, in particular, the notion of capabilities as an understanding of flourishing, both its strengths and sometimes its weaknesses, right? There's important work being done in that literature around understanding the environmental concerns as a meta capability. There's work done on or raising questions about whether the capabilities framework can adequately account for indigenous views on the appropriate human relation to the environment and so on. But the question was specifically about the RLC treatment, and I thought they didn't differentiate that enough and didn't explore the richness of the connection and maybe the limitations of the connection. So that's something I would like to see moving forward if planetary health is to succeed. Sounds like maybe I'm projecting, but it sounds like the person who asked the question might agree with that from the tone of the question.
I have a sense that would be the case. So the next question is, could the term health not itself be defined to include human health and well-being, health equity, social determinants of health, ecosystem health, terrestrial, aquatic, living and non-living components, the planet, etc., so that the health of all of us is considered in this definition? It may resolve conflicts in those who promote one concept, such as One Health, over another, such as planetary health.
Yeah, there is this idea out there, including the idea that rather than being antagonistic, right, these various conceptions are complementary, and some have even said, some proponents of, say, One Health have said that they like planetary health, that, you know, it has a good role to play. Some even think that it's a kind of logical extension, right? It's another expanding of the moral circle, and maybe some of the other health-related concepts are more inner, and planetary health is outer. I do have two concerns about it, though. One is that, as we say in the paper, and I think I mentioned in passing, though I didn't use this word, we should be aware of like hyperextensive versions of certain concepts, right? A concept doesn't necessarily get better or more powerful if it includes many, many more things within it. And one reason for that can be if part of the task or the job that the concept's supposed to do is to illuminate how to think about potential conflicts between various things, whether they're entities or principles and so on, then the more you include, the harder it is for that concept to play that role. But again, I think this is something that we could do more work on, and it would be illuminating and helpful. I mean, planetary health at the level of the words, right, it's a nice notion. It does seem to be pointing at something in the right ballpark, but then arguably so does One Health, right, that we need to be thinking of it in a more integrated way. And I think the success of any of these notions is going to be really heavily depend on how well we articulate them over time and develop their core sub-concepts that help to facilitate them playing a useful role.
So I'm going to take chair's prerogative and ask a question while we're waiting for more to come in. So in your book on the perfect moral storm, two things that you wrote really struck a deep chord with me. One is you allude to our current theoretical ineptitude in terms of our capacity to deal with the problems that we're facing. So I guess in terms of today's discussion, does planetary health make us more apt, or does it amplify our ineptitude? And then I'd really like you to speak a little bit about the threat of moral corruption that you alluded to on one of your slides, but that you discuss in detail in your book, and how we can actually, are there any protective measures we can take to fend off moral corruption?
Yeah. Thanks for asking a question related to the book as well. Yeah, I do think planetary health is trying to respond to theoretical ineptitude, but is it doing it in an adequate way? And maybe Jeff would say, well, it's helpful to have an overarching term, and if as long as it does some work, maybe that's enough, and we can quickly move on to other subjects that demand our attention, so long as that's happening. But I do think if you're looking at back at what we argued in the paper and what I suggested in the presentation, we think there's some significant internal worries about planetary health. Sometimes you introduce a new concept, and my feeling is you've really just sort of named the problem, not solved it. And if you're not careful, the fact that you've named the problem with a new concept can make it look as though you've solved it. And this brings us to the worry about moral corruption that you mentioned. So I'm worried about situations in which our judgments about how to frame things, about the appropriate concepts and norms to use and so on, become distorted by the position we're in, when that position is heavily influenced by that we will be strongly tempted to engage in very bad behavior, say in respect to future generations, with respect to poorer people in other parts of the world, or indigenous populations, or populations like that, or with respect to the natural environment, right? So one thing that would be a worrying form of moral corruption, or sign of moral corruption, is if we said, we named the problem by calling it planetary health, when other people had already named pretty close to the problem in lots of other ways before that. So we named the problem, and then we spend a couple of decades, 3 decades, trying to push the notion of this concept as if it's really resolving the problem, right? And it's really directing it directed at the fundamental features of the problem. But then it all falls apart in pretty predictable ways because actually it's a buzzword, and actually we haven't done a very good job of being inclusive about the core values, and we haven't really addressed anything concerning trade-off issues. So it's not all that action guiding, and it's not even maybe the appropriate ideal. If we do all that, then it looks as though, oh yeah, you could have done something that was theoretically inept in a way that actually encourages more corruption because it puts off doing the serious work for another few decades. And the individuals involved don't need to be corrupt, right? In fact, they're probably not. They're probably very well motivated. They want to do something about this problem. They're engaged by the concept, and they rush out of the door to do some action because of the concept. But if there's nothing much behind it, then the practice can become morally corrupt, and morally corrupt quite easily, right? And some people have written a bit about this in the bioethics concept in terms of not using my language, but wondering about previous attempts to environmentalize bioethics, right? So we're really very much at the stage where this is not a new idea that we should environmentalize bioethics, and continually throwing a new name at it every decade or so is not perhaps the best way of making progress. We should take seriously past failures and think about lessons that should be drawn from that.
Yeah, excellent. So another question has come in. Ecocentric approaches to health and well-being, planetary health, are ancient concepts in indigenous communities, and citing the Redvers Lancet paper. Could enabling DRIPA enhance efforts to achieve advances in public health? And I'm not sure I know what DRIPA stands for.
I'm not sure I do either.
So maybe
I think it's the Declaration on the Rights of Indigenous Peoples.
Oh,
yes,
okay. Yeah,
that's
okay.
correct. Thank you, Jeff.
Right.
Yeah. Okay.
Yeah, I was not familiar. I mean, I think it's a good thing that the increasing attention is being paid to indigenous frameworks for thinking about these issues, including by philosophers. I think there's some very interesting work being done across multiple continents on that. Some of it directly aimed at the health setting, so that's very good. I don't think that just because something is, well, I think we use the term ecocentric in different ways, actually, right? There's a philosophical way of using it, by which I just mean a technical way of using it. And there are more, less technical ways of using it. So we'd want to be careful about what we mean by that approach. And we also need to be respectful of the fact that although there are some strong commonalities, often indigenous philosophies differ about how they understand the ecocentrism and how they understand the way of thinking about potential conflicts and so on. So I do think that whoever posed the question is well, I agree with the idea that we need to be taking these approaches much more seriously and across cultures across the planet, and it would be helpful, useful, enlightening to do that. But I think there's actually tough work in moral and political philosophy to be done within those traditions and across them if we're really going to make progress. Including, I mean, many people within those traditions recognize that, indeed sometimes emphasize that, because they say the existing versions, understandings of how these traditions should work in practice emerged in very different ecological situation than the one we're currently in, right? So you do have to evolve the understanding of the key concepts in the indigenous traditions as well.
Do you have any thoughts about how communities could be built to pursue that understanding or bridge those concepts?
Yeah. Well, I think, again, I think there's serious work on this, and so I would defer to people who do that work. Last year, I was at a two-day workshop featuring, indigenous understandings from a number of traditions, thinking about climate adaptation or adaptation more generally. And There are lots of insightful things being said there that were interesting. And some of the stuff that was being said was about this need to evolve the understandings of those concepts, how to develop new conceptions of them amidst changing realities. So yeah, let's pay attention to that work. That would be great.
Yes, and support it and facilitate it, I suppose. We do have no further questions. And Jeff, maybe if you do have any comments you'd like to make, and then Steve, I'll ask you for some final reflections before we close.
Sure. Yeah, I'm happy to ask another question. So if I may, hoping to push back a little bit on one comment you made, Stephen. And I think it had to do along the lines of, we've been acting for so many years and, not much has changed. And so I imagine for lots of folks, they would say the exact opposite. They would say, we haven't been acting. We know what fossil fuels do to the environment. We know that what our consumption patterns need to change. We know that we can't, have this mindset of more and more and more. And we need to start conserving. We need to start, taking a step back. And so I'm curious what you would say to someone who's saying this is the sentiment that I get. And this is kind of what I get when I talk to other folks. It's like, we already know what to do. We've known what to do since way back when, before I was born. I was born in, well, I won't say when I was born, but I was born a long time ago. And we've known, at least since 1985, what we need to do, right, to curb our carbon emissions. But we're just not doing it. And so you could have, 10 different theories. You can be utilitarian, you can be a deontologist, you can be a virtue ethicist, you can be a themist ethicist, you can pick you're a pluralist, what have you. We know what to do. It's a matter of, okay, well, how can we gather everyone and collectively act together and fight perhaps those and push back against the status quo or those competing interests that kind of don't want things to change, that want our consumption patterns and our ways of kind of, perceiving our own self-worth and what have you. So I just was hoping if you might speak to that a little bit, because that's kind of what was motivating my question around action. I'll pause there.
Yeah. And in some ways, I'm very sympathetic to that view, because a long time ago, I was one of the people pointing out that there's this high level of convergence among ethical approaches about what should be done here, right? And the current situation, especially the evolution of the global climate situation over the last 35 years, would be roundly condemned by most theories, given normal kinds of assumptions about what's going on. So in some ways, that is good news. There's a lot of convergence. However, I think we also want to note that, as I noted a long time ago, that's mainly convergence on what we should not be doing, right? So it's very clear. There seems to be a broad ethical consensus that we shouldn't be doing what we're currently doing or have been doing for decades. But on what we should actually do, how we should confront it when there are difficult values questions in play is more tricky, actually. It can get easier if you adopt a very pluralistic approach, but some people in ethics are not remotely pluralistic, right? And of course, it's obvious, in some sense, it's obvious why a pluralistic approach could help you make certain kinds of progress, because there is this convergence, right? But you'd have to specify what kind of pluralism, and again, get into the kinds of questions we got into today about planetary health and what the key values are. So I think if we started to move swiftly to address some of these issues, of which climate is one, but there are others, it would quickly start to raise questions that would highlight the divisions, within the consensus about how to improve. And I do think that plays a role in explaining why we haven't acted, right? And that the successful concepts for moving us forward would be very helpful. They won't solve all the problems. Whoever thought a concept solved any problem all by itself, right? You need humans to cooperate, and there are some horrible, tragic, misaligned kinds of incentives in play which fuel moral corruption, which Ross was kind to raise. So none of this is going to be a silver bullet, but I think the division, I basically think, and you may disagree with me, I'm sure some of the listeners disagree with me, but I basically think that the clean gap between, oh, there's theory and concepts, and then there's action, that's a mistake, I think. I think you have to understand action in light of concepts, and you have to understand concepts in light of what they're trying to achieve, right? Which is partly why, right at the end of the talk, I said, I think an agenda item for moving forward is, let's try to get clearer on what problem we're trying to resolve, or what range of problems, right? Because if some people are really thinking the key problem is we can't have the global economy, slow down its rate of growth ever under any circumstances. And we need planetary health to give us an account that will show us how to achieve that, then that's going to be in tension with, say, what many people are saying, and in particular, maybe certain indigenous groups about, you guys have got a crazy idea about this growth thing, and the way you understand growth is, so what the background concepts are driving the action is always going to be very important, in my view.
Yeah, and I'm definitely in agreement in that, and that's like my third question, I think, or my third point was around, okay, well, when is good enough? When do we have a good enough idea so that we can go on with acting as we should as it relates to the challenges that lie ahead, and then not having the conceptualization get in the way of acting, but to help
Yeah, absolutely.
to
In the book, I actually say a few times, I think what we need is, we need an ethics of the transition, right? Yes, we need a grand ethics that will give us all the right answers, but we also need an ethics that will help us get through when we don't have all the right answers, but we do have some sense of the trajectory we should be on and the kinds of values that should shape that, which is an interesting way to think about, for me anyway, to think about ethics within transition. Sometimes you need concepts and approaches that are highly functional within the transition, even if you don't think that they're going to be the be all and end all in the long run. And I think that's the kind of point you were trying to make several times, but in your third comment especially.
Yeah, and this is my last point, Ross, I promise. So, and this comes back to like, so as a virtue ethicist, in terms of conceptual clarity, I really love this idea of planetary eudaimonia, or planetary health. Planetary eudaimonia instead of planetary health, and the idea of separating, planetary health and then having health as part of it. It just makes things all messy. But then for me, where my mind goes next is like, will that catch on? Like, is it marketable? Will it have, because you can have a really great concept, but then if it's not taken up by other folks, then what's the impact it's going to have? And so for me, then the question is, well, you can have conceptual clarity, but sometimes there are trade-offs in terms of impact, for example. So that's just something else that kind of came to mind. But I really do love the idea, conceptually speaking, of planetary eudaimonia, because I think it is more accurate in terms of our goals and our aims and what we achieve, and its status as in terms of like a level good. But in terms of, socializing that, I imagine that might be the challenge. Okay, thank you.
Yeah, I do think, I mean, there are potentially some disadvantages as a person trained a bit in ancient Greek philosophy. I love the term eudaimonia, and I think it's much richer than any English term. But I could see why someone might say, based on what you're saying, well, maybe we'll go with flourishing then, because it's, it's more intuitive, and it's already in there in the planetary health discourse, right? In fact, it's the core way of describing what planetary health is. That might be one advantage of it. Clearly, it resonates with people already. We just maybe need to be clearer that let's separate that from health a little bit. And I do think that there can be some advantages of reframing in just that way. Because, for example, in a lot of circles, people are thinking of planetary health. So it sounds like a good buzzword, but it's clearly one for, health people, medical practitioners, and so on. It has nothing to do with me. Whereas if we reframed it as the core concept should be planetary flourishing in this sort of intergenerational setting, and then said planetary health is part of that, and that's an important community, and we need to pay some respect to the causal influence on the planetary flourishing agenda of that community. But then you're kind of inviting other people to come in to contribute what they know and what their communities can contribute to the overall planetary flourishing agenda without making it seem like it's siloed within just the health committee. You need some kind of advanced degree in medicine to even understand it, right? That's
great. So I'm always happy when Aristotelian concepts find their way into our discussions. We have one late-breaking question, which is fairly complex, and we may not have time to answer it. But it's how do you envision this work unfolding, and who should do it? Many people integrating environmental concerns into their work are doing so off the sides of their desks and may balk at the idea of devoting time to deeper intellectual engagement. I think this might be part of the appeal for the newer, simpler framing. In some ways, planetary health is a runaway freight train. How do we rein it in without dampening enthusiasm for this work? And I'll just tie that to a thought I was having as I was listening to you and Jeff speak, because where planetary health is meant to have its impact isn't so much in public health, but in clinical medicine. They're actually charging clinicians with this task of ensuring planetary well-being. So any final thoughts on the runaway freight train, reining it in and getting people working?
Yeah. So it's good that some notion of planetary health is having some impact in sort of reorienting people's thinking. Given what we opened up with about narrow versus broad understandings of bioethics, it's kind of funny that it would turn out, well, it's in clinical ethics that it's really making a difference, right? I think that in some ways, though, there are probably some lessons to be learned by the success of ethics in clinical settings as a serious subject, to be studied, for people to be trained in, and so on. So I think we should courses on environmentalizing bioethics or environmental dimensions, environmental determinants of health, and including the philosophical frameworks should become part of the standard package of education. Just as years ago, some discussions of clinical ethics became part of the standard package. And that should occur in health-related disciplines, but I also think it should occur in environmental disciplines in general, right? Because, for example, I would say there are lots of places that in environmental studies or environment and health studies require of their students that they take a basic course in environmental economics, so they understand what that framework, all those frameworks are, and their strengths, and hopefully their limitations as well as their strengths. But I don't see quite the same push towards making sure that students across disciplines, have a bit of a foundation in studying some basic basic environmental ethics theories, including some of the ones mentioned today. Again, their strengths and their weaknesses and how they fit into a wider landscape of discussion of these things. I think students would be so much better equipped for the world. And, we all started out students, right?
Mm-hmm. Yeah.
We'd have that kind of education. The people who replace us in a few generations would be so much better situated for having these discussions if there was a kind of background expectation that they already knew something about. They had a basic course at least, and maybe some of them would have an advanced course, and maybe some of the graduate level people would have some side of their graduate training that would be in this. We see this in other parts of the academy and other things. Lots of people know a lot about economics and public policy who are working on bioethics and so on, and some environmental things, but not so many people about ethics, and that's a bit puzzling.
Yeah, music to my ears, and I couldn't agree more. So unfortunately, it's been an incredibly stimulating and rewarding discussion, but it's time to draw today's seminar to a close. So I have a couple of announcements to make before I thank our speakers. First, if you'd like to stay up to date with the Joint Center for Bioethics and for the Collaborative Center for Climate Health and Sustainable Care, you can sign up for the JCB's biweekly bioethics events digest. By sending an email to jcb.info@utoronto.ca, and I believe it's been put into the YouTube chat. And also you can contact the Collaborative Center by information on the slide. We're a newly created center and just getting started. And Stephen, you'll be I liked your idea on the message of education because I'm trying to spearhead educational efforts in this area. Second, a call for applications is now open for JCB's AMS Fitzgerald Fellowship in AI and Human-Centered Leadership. If you are an early or mid-career health system leader exploring the opportunities and challenges of AI in health in your health setting and seek to promote, foster, and advance compassion and equity in a rapidly evolving AI context, I invite you to attend our upcoming information session on April 17th at 12 to 1 p.m. Eastern Time. To learn more about the fellowship and the program, click on the fellowship page or scan the QR code to register for the information session. And finally, for those students enrolled in the collaborative specialization in bioethics, if you're enrolled in the CSB interdisciplinary seminar course, please remember to track your attendance. And so with that, finally, it's my great pleasure to, on behalf of the Joint Center for Bioethics and the Collaborative Center for Climate, Health, and Sustainable Care, to thank you, Steve, very much for taking time to share your very lucid and insightful comments on planetary health, and Jeff for your incisive commentary. It's greatly appreciated. And also to thank everyone who joined us in line today. And we look forward to seeing you again soon. And I'm going to immediately take the agenda that was posted in your presentation and start working on it. So thanks to both of you, and best to everybody. If you're in the Greater Toronto area, be careful out there in the slippery snow, and hopefully we'll all stay well. You know, the collapse of the economy may come sooner depending on the events of today, but I don't want to go too far into that. But take care, be well, and we'll see you all again. Thanks.
Thank you very much, all of you.